on a chat with the expert. I'm joined by Dr. David Edokpolor, consultant obstetrician and gynecologist at Havana Specialist Hospital. Today we're going to be talking about cervical cancer. It is a whole lot. Cervical cancer, we'll be talking about the screen, and also we'll be bursting a myth about cervical cancer. So stay with us as we quickly dive into this topic. Doctor, welcome. I'm so happy to have you here.
Thank you very much.
So, cervical cancer. Please, let's talk about it. What do we need to know? What is up? It's like everywhere now.
Yes.
Yes, what's going on with that?
Thank you very much. Thank you, viewers. Well, cervical cancer is a major global public health issue. And it is very, very important for us to know about cervical cancer because the incidence and the prevalence of cervical cancer is all over the place. So, cervical cancer is second most common malignancy in women, and it's a common cause of deaths among our women. And because of the fact that in developed societies like America and Europe, they have discovered some screening techniques, so it has reduced the way women die from cervical cancer by 75%. So it's very important for us as Nigerians in Africa to know about cervical cancer and how to prevent it. Now, particularly because from the premalignant state to the serious cases of malignancy.
So, please, when you say pre-malignant stage,
Yes.
what is that?
Okay, from the time the cervical cancer begins to develop, before this real cancer, it takes about 10 to 15 years. At that time, we can do something about it because 95% can be cured. So it is very important for us to detect it on time because a stitch in time, they say, saves 9. So cervical cancer is not also different. So once you can detect the stage before the real cancer starts, then we can be able to stop it.
Okay, so you are saying that we have 10 to 15 years window of opportunity.
Yes.
From detection until it becomes full-blown.
Yes.
Where it can kill.
Yes.
So why don't we know more? What's keeping us? What now makes it full-blown before we find it?
Yeah, thank you very much. Because people don't have information. Thank God for this your program that is trying to educate people. Health education. People need to know about this cervical cancer. How is it? What are the risk factors? What are the things that can cause it? What are the things we should prevent, we should avoid? Because once they don't know, you see, health education simply means the art of empowering people to take control over their health and thereby improve their health. And it's a core function of public health, and it helps in reducing communicable and non-communicable diseases. So thank God for this your platform that's educating the people about cervical cancer. And as we go on, we're going to talk about all the causes of cervical cancer, how we can identify them, how we can prevent them, so we can to reduce this burden of deaths among our women.
Yes, sir. So it's preventable.
It's preventable, yes.
How do we prevent it?
Well, cervical cancer now is the cause of cervical cancer is now known as human papilloma virus. Now, HPV. Now, human papilloma virus accounts for 98.7%. In fact, in cervical cancer patients, we can identify 98.7% of HPV from these women. So, targeting that HPV, preventing it from entering women's body, is one way to prevent it. So now we know that cervical cancer is caused by human papilloma virus.
So what causes the HPV?
HPV is a virus. Okay, and there are some women who are predisposed to having this virus. As we'll talk about it later, about all the people that are predisposed to it, people that are at risk of it. Number one, people who start having sex early.
How early?
Like people that start having sex around 13, 14, 12, so they are more predisposed because the vaginal epithelium, the squamous epithelium of the vagina, is not well developed yet.
That's
the vaginal canal, yes. So the one place we call the squamo-columnar junction. So once they start having sex early, that area is breached, and thereby they are more predisposed to cervical cancer. Then women that are on prolonged use of oral pills, that pills are used to prevent pregnancy.
Pills too?
Yes. People that are on prolonged pills, so they are also predisposed to it. Then women that have many children, maybe about 5 children and above. So when they have too many children, they are also predisposed to it. Then people that have HIV/AIDS. HIV is human immunodeficiency virus. Then AIDS is acquired immune deficiency syndrome. So people that have HIV and AIDS, they are also more predisposed to having cervical cancer. Then again, people that have sexual partners, if a woman has multiple sexual partners, she is more predisposed to having this cervical cancer. Then a woman that has multiple sexual partners. So if the woman has only one boyfriend, but the boyfriend has multiple sexual partners, she's also at risk of having this cervical cancer. So number one, talk about people that start having sex early, people that have many children, people that have HIV/AIDS, people that have some conditions like leukemias, Hodgkin's lymphoma, all those malignant conditions. Then people that are using pills for prolonged period. So they are the people that are very predisposed to this condition.
Okay. So what about our foods? The foods that we eat, our dieting, does it in any way contribute to maybe how healthy? Does it contribute? Does it help us not develop cervical cancer?
Food. We are normally encourage people to eat adequate diet. That is, that you eat carbohydrates, food that are rich in carbohydrates, protein, fats, mineral salts, and water. However, there's no food that is linked to cervical cancer. One thing that is linked to it is smoking. People that also smoke. Smoking is also a risk factor. Like I said, early sexual debut, smoking, pills. But food, there's no food linked to cervical cancer as of yet.
I mean, is there no good dieting we can go on to make sure to prevent cervical cancer?
Well,
it cannot help us.
Yes, eating adequate diet will help ensure the immunity of the body. And so one immunity, because I said earlier that people that have depressed immunity, people that have HIV/AIDS, people that have Hodgkin's lymphoma, leukemias, they are also predisposed because of their depressed immunity. So food that can build up our immunity, carbohydrate, protein, fats, mineral salts in adequate quantities will also help us.
So, doctor, how do we fight against cervical cancer?
Okay, very good. Now, we all have to fight against cervical cancer because cervical cancer is killing our people in Nigeria, in Africa.
Is there any statistics? Do we have a number?
Well, in abroad, they said that the incidence, the rates have dropped by 75% abroad because of what we are doing now. Educating the public, letting them know what is causing cervical cancer, then knowing how to prevent it, which I'm going to talk about now that we just asked. So now, in preventing cervical cancer, I would like to approach it under 4 major headings. One is the primary prevention. Number 2 is the secondary prevention. Number 3 is the tertiary prevention. And number 4 is the quaternary prevention. So primary prevention, secondary prevention, tertiary prevention, and quaternary prevention. Now, what is primary prevention? Primary prevention means you educate the people, just like we are doing now, to tell them that cervical cancer is in Nigeria. We should not shy away from it. We should be aware. And that it's killing people. It's causing problems, it's causing disease, and it's killing our people. And thereby separating women from their husband. Because once a woman dies, then there's the children, nobody will take care of the children. So primary prevention will include 1, telling the women about the causes. 1, like I said, they should avoid having sex on time. They should postpone sex until about 18 and above. Then number 2, they should not have too many children. Having 3 or 4 is okay. Okay. Then number 3 is that they should avoid smoking. Smoking is a risk factor for it. Then women should not take pills for prolonged period. So, and of course, so those are the prevention of the primary prevention. Now, another primary prevention is that since September 9th, 2008, NAFDAC in Nigeria has approved the use of vaccines in Nigeria. And vaccines are very, very important to our women. Apart from preventing those things, our women are supposed to be taking vaccines. Okay, so the vaccines are to prevent most of those HPV I told you about.
And these are for women?
For women.
At grown-up stage?
Yes. No, even before they grown up, we can start the vaccine early. There are indications, I will talk about that one later, then the people that can take it, and even men can also take some of these vaccines because of the human papillomavirus effect.
Okay, so let's talk about the secondary prevention of cervical cancer.
Okay, secondary prevention is we do screening. We do screening of these people. And they what we call the perpendicular smear. Now, a Greek American by the name of George Papanicolaou in 1946 did this test to check for, the premalignant state before the cancer developed. You can detect the pre-malignant condition, that means pre-cancer condition. Okay, so now that pap smear is what have helped the developed countries like America and Europe to reduce the prevalence of cervical cancer by 75%. And the pap smear is very easy to take. Now it's just a matter of woman coming to the hospital and will take a pap smear and send to the lab. And when sent to the lab will bring the result.
How often should we do this pap smear?
The pap smear should be done every 3 to 5 years.
3 to 5 years?
Yes.
Okay, so let's talk about the tertiary prevention of cervical cancer.
Okay, now the tertiary prevention of cervical cancer means that the person has already have cervical cancer. Like I said, pap smear prevention is that before it can develop to cancer, it takes about 10 to 15 years. The window of opportunity that you mentioned about. So it is very, very important for us, even after it has occurred, at maybe stage 1, stage 2 cancer, we can easily treat it. There are a lot of things we can do. One, we can do operation, what they call hysterectomy, total abdominal hysterectomy plus bilateral saprophyrectomy to remove the womb and remove the ovaries.
To remove the womb?
Yeah, remove the womb.
So even if the woman hasn't had children?
Most people, because the average age of cervical cancer is about 51 years. So most people that will have cervical cancer, most times would have maybe completed their family size. Although we can still have a few cases of people who have not completed their family size, but most cases will have completed their family size, will have finished having their babies.
Okay, so let's talk about the quaternary prevention of cervical cancer.
Okay, the quaternary prevention means that where the woman has had cancer and the stage is maybe stage 3, stage 4. At that time,
those are
advanced cases. So in that state, there's nothing much that can be done. What you just do is to treat, because the woman can have infection, so you correct infection. If she's losing blood, you transfuse the woman, you correct the anemia. Then, such women are placed in a center where they can manage such people. Centers that have access to radiotherapy, they have chemotherapy, people that have oncology people that have, cancer treating people that are there. Then, of course, that 4th stage, there's nothing much one can do again. It's inoperable. You can't operate that advanced stage. Because by that time, the cancer will have spread from the cervix to the lungs to other parts of the body, so even sometimes to the brain. So the woman is very, very advanced. So in that state, there's nothing much we can do. So that's why this program is very, very important. I'm talking about preventing it, which is what the developed societies have used to reduce the incidence of cervical cancer by 75%. So quaternary means that you put them in a hospital, what they call an hospice, then you counsel them, they put their house in order, so that because they are about to go. So you make sure that, even if they are going to go, they go well, they are well counseled, they are well prepared, that even if they are going to go, they go well. So that is quaternary, that there's nothing much one can do. It's not operable again. You can't operate them. So you can just manage the complications. If they have infection, you treat infection. If they have lost blood, they have anemia, you correct anemia. Then you correct every other thing that we associate with them.
You're just making them comfortable.
Comfortable. Yes, and they prepare their will, prepare to make sure that, if they're going to die, they die peacefully and happily.
Okay. That brings us to what symptoms can one begin to see, and then you now tell yourself, this is it. I have cervical cancer.
Very good.
Yeah. What symptoms?
Very good. Number one symptom that a woman can have is that the woman will have postcoital bleeding. Now, postcoital bleeding is that if the woman meet her husband or you meet the boyfriend or her partner, there will be blood coming out. Normally, there's supposed to be blood. So once a woman is, bleeding after sex or during sex or after sex, then the woman should begin to come for investigation and proper evaluation. At any time, even if it's once the woman meets her husband or she meets her partner and she notices that there's blood coming out, what we call postcoital bleeding, the woman should come. Then, of course, if the woman is bleeding, maybe she has gone to menopause and bleeding has stopped before, and she's having postmenopausal bleeding, then she also comes for evaluation. You can also have this foul-smelling vaginal discharge, The vaginal discharge is very foul smelling. If you enter the room, everywhere is smelling. So that woman should be investigated, should be evaluated, should come to the hospital for evaluation and investigation. Then, of course, the woman could also have pain, abdominal pain. She will have abdominal pain, and she could also have urinary symptoms with it. Maybe she normally urinate about 4 times a day. She will be urinating about 10 times, about 15 times a day. So she's already having urinary symptoms because they are linked together. So then whenever she urinates, she will be having pain. So those are signs of urinary tract infection, which can also occur with cervical issues. So now do you want to wake up to about 5-10 times in the night to pass urine? She will be waking up because of those infections. So she will have vaginal bleeding, she will have postcoital bleeding, that is, she bleed after sex, then there will be abdominal pain, foul smelling vaginal discharge. Sometimes the vagina will be blood stained, but it's smelling. In fact, you can't stay in that room. Then when she notices that kind of thing, which is a common cause of marital disharmony, then the woman should come to the hospital for evaluation and treatment.
This even causes problem in the marriage.
Yes, it causes marital disharmony. You see, when a man is staying with her wife and everything, his wife, and there's this smell, you don't want to go near her. Which is why it is very, very important for us to prevent. The key is prevention.
I want us to bust 2 myths about cervical cancer. So the first one, is it the more sexual partners a woman has, the more her chances of getting cervical cancer? Or is it she had the first boyfriend, second one? How does that work?
Okay, thank you very much. That's a very powerful, very important question. Yes, you are very correct. The more the sexual partners that the lady has, currently and even before, the more the chances of having cervical cancer. Why? Because these sexually transmitted infections, they modulate, they influence, they affect the oncogenic, the power of human papillomavirus, which is now the known etiological cause of cancer. So HPV is now the cause. So having multiple sexual partners means that the woman is exposed to different men that have infections. And those infections will now begin to influence and increase the risk of the woman having cervical cancer. So the more boyfriend the girl has, the more the risk of having cervical cancer.
The more the boyfriend. I didn't say that. The doctor did. Now, the second myth I want you to help us with is this HPV primarily in women? Men don't have it, or is it men who sleep with multiple women that have it, or is it also in men as it can grow in women?
Okay. Well, it can also occur in men, but it causes herpes. Human papilloma can also occur in men, but it doesn't cause cervical because they don't have cervix.
Yes.
So, but it can cause other kind of things like genital infections, but not cervical. So, it can also occur in men. It can also occur in men, but since men do not have cervix, so that's why it doesn't cause cervical cancer. But it can occur in men, and men can also take vaccines too.
So women also have to be careful about their men if their men are having multiple sexual partners.
Yes.
Oh, okay.
Yes.
So anyway, it comes from both parties.
Yes.
It comes from the men and it comes
from the women. Yes.
So the men are not free.
They're not free.
Yeah. So I want us to talk about Havana Specialist Hospital because that's where we are now. Yeah. So if somebody needs screening, if somebody is suspecting cervical cancer, what's the quality of care? How do we start? How do we approach Havana Specialist Hospital?
Well, Havana Specialist Hospital is a hospital that is dedicated to excellent service, in terms of quality delivery, in terms of compassionate care and excellent service. So at Havana Hospital, there are 4 gynecologists, and at every point in time in Havana, there's a gynecologist on ground, and we do screening. We have what we call we do the pap.
You do screening here
in Havana. We do pap smear here. We do pap smear in Havana Hospital, and when the results come out, we now look at the results. So and we manage people that have cervical cancer in Havana Hospital too. But primarily we do health education in Havana Hospital. We educate our women on how to prevent cervical cancer. In other words, how they can avoid multiple sexual partners, avoid all those risk factors I mentioned earlier. They also give vaccines. We have the vaccines at Havana Hospital that we give to our patients to protect them against the cervical cancer. So we have it available at any point in time, at any time of the day. We give it at Havana Hospital to our patient. And this has helped to reduce the prevalence of cervical cancer in our local community and in our environment. So we offer such services here.
That's beautiful. And this place is like one stop.
Yes, it's a one-stop shop. Because when the women come, first of all, we give them health education.
Yes.
We empower them. Like I said, health education is simply the act of empowering people to take control over their health and thereby improve their health. It's a core function of public health and is responsible for reducing the prevalence of communicable and non-communicable diseases. So at Havana Hospital, our aim essentially is to prevent disease, promote health, and prolong life. So we prevent disease at Havana, disease, promote health, and prolong life. So Havana Hospital is dedicated to that cause. For over 30 years now, Havana Hospital has been committed to preventing disease, promoting health, and prolonging lives through a dedicated team, as well as up-to-date modern equipment. And this has helped to reduce the incidence and prevalence of diseases like cervical cancer and other diseases in our environment. So what we do at Havana is that we educate the women through we undertake primary prevention, secondary prevention, tertiary prevention, and quaternary prevention in Havana Hospital. We have all the facilities to embark on such preventive measures at Havana.
Thank you very much, Doctor, for speaking with us. So it's been a wonderful educative session here with Dr. David Edokpolor of Havana Specialist Hospital. Women, we have everybody just start running down to Havana Specialist Hospital, start running down to the hospital closest to you, start going for your pap smear. Let us start fighting cervical cancer. We have 10 to 15 years window of opportunity. We can do this, we can win. Let's get started.